Hello, my name is Dr. Diwan S. Raja. Today I will discuss about the anatomy of the femoral nerve. Femoral nerve is the largest branch of the lumbar plexus and it is formed in the psoas major muscle, emerges along the lateral margin of the psoas major, passes between the iliacus and psoas major, and it passes underneath the inguinal ligament and reaches the femoral triangle. Okay, the femoral nerve is formed from the lumbar plexus by the dorsal division of the anterior or ventral primary rami of L2, L3 and L4 spinal nerves. It is formed inside the substance of the psoas major. In the substance of the psoas major. Psoas major muscle. Okay. Then it emerges along the lateral border of the psoas major muscle. Then emerges along the lateral border of the psoas major muscle. Okay. Then it passes between the iliacus and psoas major. Passes between the iliacus and psoas major muscle. Psoas major muscle. Okay, we got the course in the abdomen. Okay, then the femoral nerve passes beneath the the femoral nerve passes beneath the midpoint of the inguinal ligament. Okay, so this is L2, this is L3, this is L4, this is the femoral nerve, and it passes beneath the inguinal ligament. This is the inguinal ligament. From the anterior suprailiac spine to the pubic tubercle, we got the inguinal ligament. This is the midpoint underneath the midpoint, the femoral nerve passes to the femoral triangle, okay, to the femoral triangle, femoral triangle. Okay, we got that. So its stem is only 4 centimeter. So just below the inguinal ligament, it is around 4 to 5 centimeter. Okay. Its stem is 4 to 5 centimeter in the femoral triangle. Femoral triangle. Then it is divided into 2 divisions, anterior division and posterior division, by the lateral circumflex femoral artery. It is divided into anterior and posterior division, by the lateral circumflex femoral artery, and this happens in the femoral triangle. Okay, we got that. So it has 2 divisions, anterior division and posterior division. So this is our femoral nerve. Femoral nerve. Its root value is L2, L3, L4. Okay. It has 2 divisions, anterior division and posterior division. Okay. So we have 2 divisions, anterior division and posterior division. Okay. The femoral nerve provide innervation to the iliacus muscle before it enters underneath the inguinal ligament. This is the iliacus muscle. Okay. So the iliacus gets innervation from the femoral nerve in the abdomen, and just above the inguinal ligament, another muscular branch goes to the pectineus muscle. So pectineus muscle also gets innervation from the femoral nerve, just before it enters underneath below the inguinal ligament. Pectineus muscle has the femoral nerve, its innervation, but pectineus nerve may have dual innervation. It may be innervated by the obturator nerve also. Okay. So in the abdomen, femoral nerve provides 2 muscles. So in the abdomen, femoral nerve provides the femoral nerve innervates the iliacus, and certainly the pectineus just before the inguinal ligament and pectineus muscle. Okay, then we'll go to the branching from the anterior division and posterior division. From anterior division, suppose this is the anterior division. Okay, anterior division of the femoral nerve. Okay, so anterior division by the anterior division, it innervates the muscle sartorius. Okay, innervation to the sartorius muscle, sartorius muscle. Okay, sartorius muscle. Okay, so this is the sartorius muscle. Okay, and from the anterior division we have also cutaneous innervation. This is muscular innervation. Cutaneous innervation, we have two cutaneous branches. We have the intermediate cutaneous nerve of the thigh and medial cutaneous nerve of the thigh. Okay, this cutaneous nerves penetrate the fascia lata, the deep fascia on the thigh area. So then it innervates the skin. Okay, we got innervation from the anterior division. Again, one muscle sartorius and two cutaneous branches. One is the intermediate cutaneous nerve of the thigh, another one is the medial cutaneous nerve of the thigh. They all are present on the anterior aspect of the thigh. Okay, we got that. So we got the anterior division branches. From posterior division, we have the muscular branches to the rectus femoris. This is rectus femoris. To the vastus lateralis, then vastus intermedius, then vastus medialis, Another muscle called the articularis genu, and articularis genu. This is a small slip of muscle that take origin from the anterior part, the lower end of the shaft of the femur that goes to the synovial membrane of the knee joint. Okay, articularis genu actually get innervation through the nerve to the vastus intermedius that goes to the articularis genu. That is a branch of the posterior division of the femoral nerve. Okay, we got the muscular branches. How about cutaneous branches? Posterior division of the femoral nerve has a cutaneous branch that is called saphenous nerve. Okay, cutaneous branch that is the saphenous nerve. Okay, saphenous nerve is the cutaneous nerve that is coming out of the posterior division of the femoral nerve, and that nerve is a long nerve. It goes to the adductor canal. It is close relationship to that of the femoral vessels, and it comes out between the sartorius and gracilis near the medial side of the knee joint, and it goes along with the saphenous nerve and pick up sensation from the medial side of the knee, the medial side of the leg, medial side of the dorsum of the foot up to the ball of the great toe. And the saphenous nerve is accompanied by the great saphenous vein up to the knee. And saphenous nerve is a branch of the posterior division of the femoral nerve. We got the anterior division, posterior division. We got the branches in the abdomen. Okay, so we got the muscular branches, cutaneous branches. The femoral nerve has also articular branches. Femoral nerve innervates the hip joint. Femoral nerve innervates the knee joint. Okay, femoral nerve innervates the hip joint and the knee joint. Okay, we know that from Hilton's law, if a muscle passes over a joint, the nerve supplying the muscle innervates the joint and the skin overlying the muscle. That is the Hilton's law. So the knee joint and the hip joint both are innervated by the femoral nerve, because femoral nerve supplies the muscle, that muscle crosses the hip joint, also the knee joint. Okay. Femoral nerve also has vascular branch. Okay, vascular branch. It supplies the it innervates the femoral artery. Okay, especially the sympathetic fibers going through the femoral nerve goes to the femoral artery. Okay, we got the branches of the femoral nerve. Okay, so now we'll go to some of the clinical anatomy. Femoral nerve is very important nerve. If it is damaged due to trauma or gunshot injury, then muscle would be paralyzed, and the muscle's loss of hip flexion, loss of knee extension, plus loss of cutaneous sensation from the anterior and medial aspect of the thigh, medial side of the knee, medial side of the leg, medial side of the foot up to the ball of the great toe. Okay, so femoral nerve injury, one of the clinical anatomy. Another importance is all the physician practice, that is they test the patellar tendon reflex test. Patellar tendon reflex or knee jerk test. So physician tape on the ligamentum patelli and look at the movement of the knee joint. The knee joint should extend on tapping on the ligamentum patelli. That indicates the lumbar 2, lumbar 3, lumbar 4 spinal cord segments are intact, because the ligamentum patelli is the continuation of the quadratus femoris tendon, and nerve supply is from the femoral nerve. Okay, so that's all about the femoral nerve anatomy. If you like my video, please support my channel and please subscribe me. Have a nice day. Bye now.